For all the details on what happened to me regarding my injury, we're pushing 100 hours plus of video now. YouTube channel, My Medical Nightmare. Alright, in a new video series, we're going to take my old medical imagery, that's CTs, MRIs, and X-rays, and we're going to put them in front of some new doctors and medical experts, and we're going to get some third-party opinions on what appears therein. The material you see on my channel is really only half of my story. I've had to be real careful on what I've disclosed and discussed on the treatment side, because as you can see in my videos, when I found out I was misdiagnosed and took them back to the doctors and the hospitals, they of course denied any injury appeared in those pictures. And what's more, they refused to re-examine the data and would not help me in any way to correct those errors. When I sought out other doctors and providers, they took these images and contacted the original doctors. They proceeded to badmouth me. They ruined several relationships that I had with new healthcare providers. UAB, for example, who after a certain point would only place me on waiting lists. I was given an 8-month waiting estimate to see just a general family physician. Alright, so today an image which shows an area between the underside of my skull and the C1 atlas vertebrae. I had this CT done without contrast on 4/22/2019 at St. Vincent's East Hospital, Birmingham, Alabama, formerly Ascension, now UAB. This image series was looked at by Birmingham Radiological Group Dr. Julian Patrick Druhan. Returned a reading claiming I had no injuries present in this scan, and this was absolutely not true. The serious head trauma based injury that I had, I almost died from soon after this. So I'll show here the old report where the doctor claims I had no injuries. This picture and this scan may be the single most important piece of medical imagery that I received. This is the kind of injury that does not heal easily and usually requires emergency surgery. I was sent home. I did not receive any treatment. This area in my neck, it did not heal, and infection began to grow. This grew to several inches in diameter. The source of the infection that was noted by medical providers later on, this had to originate from some larger causative factor. I had a chance to put this imagery in front of some new experts. It looks like the true extent of my injuries at the time may have been more complicated. Alright, so the area we're looking at, an axial view of the craniovertebral junction, specifically focusing on the base of the skull and the first cervical vertebrae, C1, the atlas. Primary findings. Within the highlighted red region, patient's left side image right, there's a significant disruption in the cortical continuity of the C1 lateral mass and posterior arch. This appearance may suggest a comminuted fracture where the bone breaks into several fragments. The bone in this area appears irregular and displaced when compared to the contralateral side, that's the patient's right. These findings could reflect an acute traumatic injury to the atlas, such as a Jefferson-type burst fracture or a complex lateral mass fracture. In continuing examination details comparison. When comparing the highlighted region to the opposite side of the image, the normal ring-like structure of the C1 vertebrae is lost. The contralateral patient's right side shows a more continuous and expected cortical outline. Anatomical deviation. The fragments in the red box appear to be shifted, which could indicate instability at the craniovertebral junction. The findings are highly consistent with an acute fracture of the C1 vertebra atlas on the patient's left side. Because injuries to the upper cervical spine carry a high risk of instability and potential neurological complications, this requires immediate evaluation by a neurosurgeon or orthopedic spine specialist, and usually necessitates stabilization, such as a cervical collar, until fully cleared. Alabama-based Birmingham Radiological Group. They claim to have 45 radiologists on the payroll and are composed of doctors that examine MRI, X-rays, and CT imagery. Many doctors and medical practices in the Birmingham area rely on their services, and you may be surprised if you went to see a doctor and had an MRI, CT, or X-ray in the Birmingham area. A BRG, Birmingham Radiological Group doctor, may have examined your images, and you may not be aware of it until later. I was a customer and patient of Birmingham Radiological Group in 2018 and 2019. I had 3 of their doctors look at MRI, CT, and X-ray of a major injury that I had in my head. I almost died from this. These doctors wrote in their reports that I had no injury present. I knew otherwise. Went and got the pictures. I'll put the pictures up here yet again. And what is clearly visible at this time when I was being told these falsehoods was that around 6 inches in diameter of infection appears inside my head. I'd actually broken my skull in the basilar area in the region of the occipital condyle and condylar canal. My issues are unresolved outstanding as it relates to Birmingham Radiological Group doctors Angus Baird, MD, Julian Patrick Druhan, MD, and Donald Shane Kelly, MD. I called the CEO, Doyle Stewart, and he told me in a recorded phone call that he was not going to help me get my own images looked at again or to correct the errors of their doctors.